is my pleasure to welcome Jeanne. Did I pronounce that correct? It's not Jeanne, and David. They're going to be talking about fresh air and anti-tobacco. And I realize exactly in this moment, I don't have your bios pulled up. I am so very sorry. So I'm going to turn it over to you right now. And if you can give us an introduction in the absence of my having that at my fingertips, I'll be very grateful. Welcome.
I'm Jeanne Weigum, and like Michelle, I'm a social worker, although retired mostly. I've been active with the Association for Non-Smokers since 1975 and have been a volunteer with them ever since. Passionate about the issue and eager to share it with you. And I actually served on the Clearway board when it was called MPAT with Peggy. And that was Peggy I knew from the legislature, but then the two of us served on the MPAT board and got to know each other a whole lot better. So I'll turn it over to David and he'll take it away.
Thank you, Jeanne. Can you all hear me okay? Great. Well, my name is David Willoughby. I'm the CEO for Clearway, Minnesota, and I just completed 20 years, November 1st, as CEO for Clearway. I'm going to share my screen. Michelle and I worked on this morning, so I hope it goes as successfully as it did this morning. I've got a few slides that I'm going to present that talk a little bit about our organization and who we are and what we've done. Let me just check to make sure everybody's seeing that. Good. Michelle's giving me the thumbs up, so great. Thank you so much. It's really great to be here. Peggy, thank you for the invitation. Jeanne and I are thrilled to always talk about the work that is being done around the state of Minnesota to reduce the harm of commercial tobacco. Clearway, Minnesota has been around for 20 years, well, actually now almost 22, since 1998, and I am the CEO. And as I mentioned, just completed my 20-year anniversary. Let's talk about the beginning and how this all started. First of all, those of you who remember the 1990s, there were the tobacco trials where many states sued major cigarette companies for, in essence, knowingly designing and selling addictive, deadly products to the public. And in 1998, 5 of the largest cigarette manufacturers settled those lawsuits for billions of dollars. Now, unfortunately, we've seen around the country that as payments pour into the state coffers year after year, officials see it as free money and in most cases use it for everything under the sun except tobacco control work. Nationwide, less than 3% of settlement monies tackles tobacco work today. Meanwhile, tobacco is still the leading cause of preventable death 22 years later. Now, how did we begin? Here in Minnesota, we did handle things a little differently. Now, don't get me wrong, we do have governors and legislators that have their own priorities, but yes, we did spend some money and it still continues to be spent on tobacco control. Minnesota received $202 million out of the $6 billion tobacco settlement, which basically helped establish the life and establish our organization. Jeanne referred to it as MPAT, the Minnesota Partnership for Action Against Tobacco. That was our first name. Many people were confused by that. So a few years into our life, we changed it to Clearway, Minnesota. And our mission has been to enhance the life of Minnesotans by reducing commercial tobacco use and exposure to secondhand smoke through research, action, and collaboration. Now, there are a number of things, 4 in fact, that make us unique in the country. First of all, we're focused exclusively on tobacco control. Secondly, we are a nonprofit. We are not part of the state government. Our honorary board chairs, Dr. C. Everett Koop, former Surgeon General, and Dr. David Kessler, former FDA commissioner, really anticipated that states would try to take money away. And so they put us under the protection of the Ramsey County District Court to protect our dollars and keep us from having those being taken away. Thirdly, we're set up as a life-limited organization. We actually have a maximum lifespan of 25 years, and we are winding down. We expect to go out of existence sometime next year. And I will tell you, it's in these times with the rise of vaping and so forth, sometimes it's stressful thinking about us going out of existence with still many needs. However, we did embrace our life-limited status, and we sought to find the ways to get the biggest bang for our buck in a short period of time. And finally, our last thing that makes us unique is our comprehensive approach. 4 different programmatic areas, or 5, excuse me. So let me talk about those briefly. Our first core area is that of cessation, or the science of helping individuals quit nicotine and tobacco use. First and foremost, we have always been about helping Minnesotans have a free opportunity to quit smoking. Since 2001, our flagship program, Quit Plan Services, has provided free to all Minnesotans who need it medication, nicotine replacement medication, and counseling to help them attempt to quit smoking using the most effective and scientific methods. We have also, through Quit Plan, provided tailored services for specific communities. One example of that is our American Indian Quit Line, which was designed to help Native people quit cigarette smoking while respecting their sacred tobacco traditions. So in the 20 years, nearly 200,000 Minnesotans have received free help through Quit Plan services. As part of our sunset, our program closed earlier this year, and we're fortunate to have worked with many of our partners to help get funding to the health department, who launched a replacement program to help tobacco users get free help to quit smoking as well. Secondly, our research has been another pillar of our organization. Our scientists have led research efforts like the Minnesota Adult Tobacco Survey, the study that tracks our state's smoking rates, as well as other behaviors and attitudes of Minnesota tobacco users. We have published extensively, adding to the scientific literature to advance the fight against tobacco use, and we have provided to organizations throughout the state over $33 million in research grants to institutions like the University of Minnesota, the Mayo Clinic, and other researchers to help find ways to reduce the harm that tobacco causes the people of Minnesota. Another area, our third core area, is that of working with communities and community development. While Minnesota's smoking rate currently is at an all-time low of around 14%, in many communities of color and other diverse populations, it is much higher. And many of those members of those populations suffer disproportionately from tobacco-related death and disease. Most notably, here in Minnesota, the tribal communities have a statewide smoking rate of approximately 60%. So we've made it a priority to fund health workers and advocates within those communities to work to reduce commercial tobacco use and improve the health of their communities. Fourth, we know that policy change is a top tool for reducing smoking and making it last for a long period of time. In the past 20 years, we have organized successful campaigns both at the state and local levels. We've helped pass a statewide smoke-free policy. We made sure that tobacco products remained expensive for kids by raising the tobacco tax, not only on cigarettes, but also on e-cigarettes. We also, last year, we were just talking about, we were able to pass one of the few things that passed the legislature beside coronavirus relief. We raised the age of tobacco sales to 21, and we're very thrilled about that. One of the things that we've been working in many communities and expect to have a statewide push this legislative session is restricting menthol and other flavored tobacco sales at a statewide level. Finally, we complemented all this work with a mass media advertising campaign that educates people of the dangers of smoking and directs tobacco users to quit smoking and where to find that help. Now, as I said, We received only $202 million. Now, it's not only, that's quite a bit compared to many states, but I'm proud to report that through careful stewardship and investing, to date, we have actually spent, almost 22 years later, $280 million on programs that I have just outlined. And of course, we haven't done that alone. From the start, we've collaborated with many partners, large and small, to take on all these different tobacco control issues from many different angles. In 2018, we celebrated our 20-year anniversary, and analysis was released to show the impact that tobacco prevention and cessation programs had upon our state in the past 2 decades. As you can see, these initiatives have accelerated the progress in our state. Clearway and our partners have helped Minnesota rank 14th in the nation for tobacco prevention and cessation funding. We've raised tobacco taxes. As I mentioned, we've passed smoke-free laws, which included e-cigarettes. Now, we also see that our youth smoking rate is at a historic low, below 10%. However, we know that the youth vaping rate is much higher, and that is a concern. This study also showed that over the past 20 years, we have been able to we've been able to provide over $5 billion in healthcare and worker productivity costs. We've prevented over 4,000 deaths. We've prevented over 4,000 cancer diseases and tens of thousands of hospitalizations over the past 20 years. Now, this slide gives you an idea of the funding according to CDC's our Center for Disease Control's best practices. And as you can see, they have 5 different categories where they feel that states should fund in a comprehensive way to have successful outcomes. And as you can see in each one of these, in some places we had partners. In this first one here, we have Blue Cross and Blue Shield and the health department who've been helping. However, in the mass media communications intervention, we've been the only one funding there. In the cessation related area, we're thrilled that we were able to get dollars so that the health department can now continue the quit line. We will not be able to do our Minnesota Adult Tobacco Survey, or MATS, but the state health department does a youth tobacco survey, as well as our behavior risk factors surveillance system, which also looks at tobacco use as well. And then finally, some of the things, infrastructure and administration. As I mentioned, we've been able to provide over $33 million in grants. So as you look at this chart, the yellow categories go away. And that leaves significant levels of funding, and especially under mass media, it leaves those missing for our state. And so we are looking to, help this session also increase funding for the health department to be able to complete or continue some of that work. A lot of thought has gone into the concept of sustainability, and we've worked with our partners to help create some of that. We created with Blue Cross Blue Shield, the health department, and many of our other partners, a tobacco control vision. And this happened in 2016 to 2021. And I know we continue to work on providing further structure and framework to sustain the work beyond the life of Clearway, Minnesota. Because of the impact of tobacco prevention and cessation over long periods of time, for instance, if somebody quits smoking or a child never starts, we know that both in time, lives, health, and money, that work goes long into the future. So make no mistake, there's a lot of work to be done. I'm grateful for the opportunity to share with you all today some of the success that we at Clearway have had. And we look forward to coordinating with Jeanne and others in the work in the future as they take that forward as we go out of existence. And I hope that those of you who are here will also be able to do what you can to help in this great battle to help reduce the harm of tobacco in Minnesota. Thank you so much for the opportunity. I'm going to turn it back over to Jeanne. I know we're going to take some questions towards the end, so I'm going to stop sharing. And there we go. Jeanne?
Okay, I'm going to ask you to write something down that you can kind of refer back to as we go forward. I've got 3 numbers for you to write down. 1,128, 1,315, and 10 billion. So 1,128, 1,315, and 10 billion. So first of all, I'm going to tell you, without the support from Clearway, ANSR would never have accomplished the kinds of things we've been able to do in Minnesota. And the gap in funding, the gap in support that's looming is really frightening. Clearway, David was modest. Clearway has provided the bulk of funding that has gone to local community groups to support tobacco prevention activities. And with that going away, Blue Cross contributes a small amount, MDH contributes a very small amount. So the infrastructure that has been built largely with Clearway money, we don't want to go away with Clearway, but it's definitely threatened. So that's at the core of what we're doing. The numbers I just gave you, the 1,128, are the number of daily deaths we're seeing right now from COVID. And that number is obviously changing from day to day, but right as of today, that's the number. 1,315 is the number of tobacco-caused deaths that we face day in, day out over decades. The total number of deaths caused by tobacco use in the country is well over 400,000 per year. And you've got to ask yourself, okay, so we're facing half that many deaths at this point annually from COVID, almost the same number daily from COVID. Why is it that the healthcare system is collapsing with this when we've been absorbing that from tobacco all these years? The only thing I can come up with is that tobacco sneaked up on us slowly. The number of deaths accumulated slowly. There's never been a surge. There never will be a surge. It's a steady march of tobacco-caused deaths. And our healthcare system has evolved to tolerate that number of deaths year in and year out without collapsing. And I've got to tell you, the $10 billion number I gave you, that's the cost to date of Operation Warp Speed. Operation Warp Speed was intended to develop a vaccine and get it distributed. What I long for, and which will probably never happen, is an Operation Warp Speed for tobacco. We're facing similar kinds of deaths, similar consequences. Surgeon General Koop, who David mentioned earlier, said tobacco is a childhood disease, the consequences of which come later in life. And that's, again, as you compare it to COVID, it's an awful lot of young people who are spreading it around, and it's an awful lot of older people who are dying from it. So the comparison between the two is interesting, and I agree 100% with Operation Warp Speed. I just want us to take a similar serious approach to tobacco, because we're going to get a vaccine for COVID. We have no such light on the horizon at this point for tobacco. So people like me and people like David who've been trying to deal with those 400,000 deaths per year, what are we up to? Well, there are 2 basic approaches. One is helping individuals quit smoking, and the other is everything else. So the kind of policy and educational work that we do. ANSR does not do any individual cessation. We don't know how to do that. That's not our long suit. Other people can do that. Our policy, our niche has really been education and policy. And our policy work has been aimed at reducing youth access to tobacco, reducing the demand of tobacco among young people, protecting non-smokers with clean air, and that includes apartment buildings and townhomes, as well as workplaces, bars, those kinds of places. That has been our niche. We've had a really long history of working in Golden Valley. that goes back at least 20 years when we worked with Mayor Anderson, I believe. Is that a right name, Mayor Anderson? I think. We worked with her on developing policies on compliance checks, reducing youth access to tobacco. That was really the first work we did in Golden Valley. Since then, we've worked on clean indoor air ordinances, prohibiting the sale of flavored tobacco products, and most recently, Golden Valley adopted a spacing requirement. We love working with Golden Valley. You're not afraid to be a leader. You're not afraid to be the first or the best. And that has been, you have been fertile territory for us working on trying to reduce the total number of deaths that we experience and reduce the addiction. So the things that we're working on moving forward relate to vaping. Our youth tobacco use rate, if you look just at smoking, is at a historical low. We've really won the war when it comes to Marlboros. We've completely lost the war when it comes to vaping. So young people are getting addicted to nicotine, and it's having a catastrophic effect on their lives and on their future health. We suspect that vaping may at some point lead to smoking traditional cigarettes. There's some evidence suggesting that, but vaping by itself is an unhealthy and a dangerous activity. I'm going to show you some things which I know, Shep, this is old news for you, but it may be new news for some of you. I'm going to show you some of the products that this very inventive industry has come up with. This is a Juul. Some of you have heard of Juul. It looks a little bit like a USB drive. It pulls apart and you can put your nicotine in there. This really is the product that started the vaping crisis. Prior to this product, vape products were hard to use. They didn't deliver much nicotine. They delivered it very slowly. It didn't get to the brain and give you the hit that people were used to from cigarettes. So until Juul came along, vaping really was kind of a non-issue. Juul discovered something called nicotine salts, and it delivers a nicotine blast to the brain almost instantaneously. And Juul came up with some wonderful flavors, and we have ended up with a generation of young people addicted to nicotine thanks to Juul. And they're being sued, by the way, by our current Attorney General. So we're starting over on the same road that started 25 years ago that David mentioned. This is a bottle of nicotine juice, and there are some e-cigarettes that you can fill yourself so that you add the amount of dose you want. By the way, this stuff, what you're missing here is the horrible smell. These things are all highly flavored products, and we keep them in bins to try and keep them from smelling up our office. I don't remember even the name of this thing. It comes in a beautiful bottle though. This is called Pancake House, and it's vape juice. There are vape juices that come in every conceivable thing. Waffle flavored, banana flavored, grape is a big one. This is a new style vape product, a vape thing. This is a disposable. They're fairly cheap. Our talking with young people indicates that this is the primary, this type of thing is the primary product that young people are using now. They tend not to be using the bigger refillable products, but are using these disposables. The industry has serious money in design. This is a box that, I mean, everything comes beautiful. And this is a Soren, which looks a little bit like this. If you saw this in your kid's vape, in your kid's backpack, you might not even think about what it is. This is a refillable product that you can use some of these things to refill. And this is very popular among youth. It also came on the market using the nicotine salts. And this is a vape watch. It's a regular watch, but it pulls apart. If I can figure out how to do it. Well, here's the date and time. It pulls apart and you actually can vape with the centerpiece in this watch. There are lipstick tubes. Somebody's borrowed one of our kits. We have these kits for people to use when they're doing educational presentations, and our lipstick tube is out right now. But it looks just like a great big tube of lipstick, and it's a vape product. Perhaps one of the more interesting items is the Vape Hoodie. This hoodie has these strings, and you can put your vape product in one end, and there's a tube that goes all the way around. You can vape through the other end. These are all things that have zero interest to adults and a lot of interest for young people. And it's hardly surprising that young people have been caught up with this. Nearly 100% of these products have flavors in them. That the things that I showed you, those kinds of flavors, there are literally hundreds of flavors that are in them. And there's some research that indicates that the flavorants themselves can be toxic to the lungs. The industry is fond of saying this is all food grade material that they're using, but we don't put bananas in our lungs. And this stuff goes directly to the lung. It may be food grade, but again, food grade is not intended for lungs, it's intended for stomachs. So the industry's argument that this is all good, safe stuff just doesn't hold water. One of the other things that we know is that a high percentage of young people who use these kinds of vape products also are vaping marijuana from them. And with South Dakota joining the crowd of recreational marijuana states, it will probably increase the availability of that to young people who are wishing to use marijuana. Those are called dab pens or carts. So if you hear kids or young people talking about dab pens or carts, they're really talking about vaping marijuana. So what can we do about it? The flavor issue that David mentioned, it's absolutely 100% legal to prohibit the sale of flavored products in this state. And Golden Valley has taken the lead on doing that. You cannot legally buy banana flavored vapes in Golden Valley. And so you are to be congratulated on that. What we need to do is take that to the state. And that's one of the things we're going to be working on very hard. By the way, we looked it up in Golden Valley. I understand Golden Valley students go to 2 different school districts. We looked at the vape rates in those school districts, and depending on the grade, young people are vaping at a rate of 15 to 25% in those 2 school districts. So it's a problem that is alive and well in your community. And since your kids are not limited to living in Golden Valley, the only way we're going to deal with this whole issue is as we deal with it on a statewide basis. So help us as we do that. One of the other issues we're working on at ANSR, not at the state level at this point, but at ANSR, is price discounting. Price is the single most effective way of reducing youth starting to smoke and helping adults quit. Some of us are of an age where we remember our parents saying to us, when cigarettes get to be 50 cents a pack, I'm quitting. Well, they're almost $10 a pack now. And that increase in price, much of it tax, has helped literally thousands of people quit smoking and has prevented many young people from starting to smoke. But the tobacco industry doesn't take that lying down either. And everybody likes a bargain. So the tobacco industry spends the vast majority of its marketing now on buying prices down on tobacco products. So they do it through point of sale. So at the point of sale, you might say 2 for 1 or 50 cents off or something like that. That's all promotion being done, not by that individual retailer. That's being done through the tobacco industry. They also do coupons through the mail. and on your app on your phone. So if you are on a tobacco company list, let's say you're on the Marlboro list, when you drive by a speedway, you may get a pop-up on your phone that says, in the next 10 minutes at the speedway that you just happen to be driving by, you can get 75 cents off on a pack of cigarettes. This kind of advertising promotion of a product undercuts our efforts at helping people quit and helping people stay off cigarettes. It absolutely undermines people's resolution. Research that Clearway did a few years ago showed that if a smoker had gotten anything, any kind of gift from the tobacco companies, whether it was a coupon or a hat or a belt or whatever, they were much less likely to either try to quit smoking or to want to quit smoking. So the tobacco industry, with their gift giving, is promoting their product in a very effective way. And again, I mentioned earlier, these people spend a lot of money on design. I'm going to show you some things. This pretty envelope, the gold envelope, had this little envelope inside. So we've got two pieces here. And then we have the third piece, which is something that folds and wraps like this. This is a Marlboro, I think. I can't get that right. Anyway, it is a four-way fold, and then there's a pocket that you pull out with your coupons. One of the things we've observed is while non-smokers go ooh and ah about really big coupons, most of the coupons the tobacco industry sends out aren't that big. So apparently 25 or 50 cents off is as effective as a lot of money off. Even a little bit off seems to be an incentive for smokers to use the coupons. One of the things Minnesota has something called the Unfair Price Act, which says that there has to be a base price for a pack of cigarettes, and the retailer has to sell tobacco at that price. However, the way the law was written does not cover things like in-store discounts and these coupons. So as long as the base price is at the state minimum, they can discount it any way they want. We have been able to find places where you can get 2 packs of cigarettes for $2 or $3 when the average price is close to $10. So the tobacco industry is using kind of every tool in their kit to provide incentive to people to continue to use their product. And one of the things we're working on at ANSR is a ban on coupon redemption and setting a minimum price on tobacco that stands with or without any of these in-store discounts. So we're pursuing that right now in a couple of communities, and Shep, we'd be delighted to come to Golden Valley and work there with you. That would be something we'd be just real happy about doing. So those are the things we're working on. We're going to be going to the legislature with our hands out, saying that every year the state gets just under $200 million a year, every year, as part of the tobacco settlement. Most people aren't aware of that. They're ongoing payments in perpetuity. About $200 million a year comes into the state of Minnesota. All of that goes directly to the general fund. Not a penny is dedicated to tobacco prevention or any kind of public health. We'll be going to the legislature this year saying, Clearway's going away. There's nothing to replace it. The tobacco industry is continuing to send money to the state. Some of that money ought to go to tobacco prevention. So that's what we're going to be working on at the state level this year, both the funding and the flavors piece. And then ANSR, using other resources, will be working on the price piece at the local level. So that's what we're up to, and you can help. You can help by doing some additional things in Golden Valley, and telling your legislator that you support these issues and encouraging them to support both the flavor restrictions and continuing funding. So at this point, both David and I would love to take your questions.
I have a question. Excuse me. You didn't talk about secondhand smoke. Is that possible to track? And is there any kind of secondhand smoke impact from vaping?
Hasn't been studied much. I've been in a room with people vaping, and it is super irritating to the throat. It's super irritating. It's going to be possible to get that information. I don't think we've got it yet. They don't give off any carbon monoxide. I mean, and that's one of the big things in secondhand smoke. But we do know that they give off heavy metals and nicotine. Both of those things are in they call it vapor. It's not vapor.
Aerosol, yeah.
Aerosol, it's aerosol. You're right, David. It's not vapor. They say it's vapor, which sort of implies something out of a tea kettle. This is not out of a tea kettle. This contains heavy metals for certain. It contains whatever the ingredients are and the flavorants, and it certainly contains nicotine. In terms of clean indoor air, I did gloss over that. The big area that we continue to be concerned about with clean indoor air is in multi-unit housing. Smoke moves 2 units in multi-unit housing. Most of the air that's in one unit has been in somebody else's unit. And that contains, whether it's cooking stuff or it's tobacco smoke, and tobacco smoke continues to be deadly. So we're working on that. The city of Bloomington seems poised to require that apartment buildings be smoke-free. They're just beginning their work on that. 3 years ago, I think it was, no, it was 17. The federal government declared all HUD housing that's multi-unit, not the standalone housing, but the multi-unit housing, to be smoke-free. And we've continued to work with, that's been one of our projects at ANSR, is we've worked very hard with managers and owners of multi-unit buildings that are HUD buildings to help them comply with this requirement.
Well, Jeannie, to that point, we're going to need your help, because we've got a HUD unit in a HUD building in Golden Valley, Dover Hill, where we've had residents call and complain about. Well, we have a program for that. Good. Let's reconnect. We'll do that. Thank you.
I've got a question. I think that David, you had mentioned that Coop had written in for the funding piece through Ramsey County, a certain guarantee. Does that run out? How is that different than the 200 million per year that's coming in that Jeannie was just talking about?
Good question. Thank you. What we did is we received $202 million. We received $102 million up front and then $10 million. So within 10 years, we had received all our dollars from the tobacco company. And so we invested that, but we have a 25-year life period maximum. Now we're going to be going out about 23 years, 23 and a half years, but what Jeannie was talking about is that $6 billion settlement, that $6 billion was just estimated on 25 years. Okay, so that was a $6 billion settlement based on 25 years. Those payments, as Jeannie said, all come from the tobacco industry every year in perpetuity, and they're based on the amount of tobacco sales by each cigarette company, and that's how they estimate the tobacco sales. So as Jeannie is saying, there's over $200 million every year going into the general fund still from that tobacco settlement, and it goes to every state in the country. That's why I mentioned that very few states now actually use it for tobacco control. So that's a real shame. And that's why I think what we're going to the legislature, Jeannie's talking about it, is to try to get some of that dollars designated to the health department or others to continue this work now that we're going out of existence. Does that answer your question?
Most legislators are not aware that that money comes in and goes into the general fund. They just get a revenue statement and it's buried in there. I mean, it's not that it's hidden, but it's just in there in a long list of money coming in. And every year that money comes in from the tobacco companies and just gets reallocated. And it goes for the good work of the state. I mean, it goes for housing and bridges and roads and corrections and mental health and food. It's just general fund money. The problem is this is tobacco settlement money, and I think some of it ought to go to prevention.
Right. And it seems to me too is that maybe something that may come out of COVID is a comprehensive health plan, because the CDC's A study indicated, you know, that people are dying because of these experiences. And these people who are smoking at home with children at home, you know, are just perpetuating bad health. Your analysis of how our health system just got used to dealing with chronic disease like diabetes and smoking. There won't be a surge in that per se, but it keeps affecting the same group of people, and we're not doing anything about it.
Oh, health disparities when it comes to tobacco are enormous. Most of the things we need to do in this country to impact disparities are really, really hard and take a lot of money. Just stopping selling tobacco to people would make an enormous change in health disparities, because tobacco plays such a dominant role in that. David's numbers on Native American smoking are just appalling. And the tobacco industry has targeted the African American, LGBTQ, Native communities very successfully, and their health is paying the price.
Thank you.
I'm curious about being a time-limited organization. Why was that set up? And can you get an extension, maybe, if the hope was that we would be?
We can't get an extension. We tried to do that. I was not here in the state when the settlement negotiations were happening, but I did hear from some of the legal team that it was a part of it. There was some real resistance on the part of the governor at that time and many of the legislators in taking some of that money, that $202 million, and establishing an independent organization. And so one of the things to get buy-in was that they would make it limited. They would limit the amount of time that organization would get the dollars and how it would be, and its life. And so as a result of that, it helped get the buy-in from the Governor Carlson never did have buy-in to it, but many of the other legislators did, and so it made it into the settlement. But that was part of their negotiation with state leadership to be able to say, okay, if it's life limited, then we've got this period of time where some of this money won't be controlled by the state legislature or by state government. That's one of the main reasons. We've actually found the benefit in that it allowed us to really focus and to really prioritize the key areas that we felt we could impact and make a difference. So we embraced that and have seen, as you can see, some real success.
And as you sunset, will you be passing along, I don't know, your learnings or efforts to another organization that might be longer standing in addressing this issue? I guess just hoping that all that you've done, continues to be evolved and worked on.
Good question. And we have extensively published in peer-reviewed journals. We've shared the health department, like our Minnesota Adult Tobacco Survey, we've always done with the health department. They own that data. Many of the research grants that we've done have been to the University of Minnesota. So many of those researchers, Mayo Clinic, many have published their materials and research. So we have made a real effort to make sure that as we have learned things, we share those not only locally, but at a national level as well.
Great. Thank you.
David, can you Can you tell me what happens to the assets and the fund balance of Clearway once its life is
Well,
in?
what happens, the way it was written in, is that if there's any money left over, it goes into the general fund. And so we are trying to, I'm going to put it in an analogy. We're trying to land the airplane on the runway so that we don't come too short, and crash before we land, or don't go and overshoot it. We are working to try to spend, all the money that we can on tobacco control, because we know once it goes back into the general fund, look at how all this money is being currently spent. So as of right now, actually, that's the reason why we're going out a little early. We decided to ramp up. And in the past 5 years, to really do some of the things that we've been talking about with Jeanne, in getting T21 passed, in raising tobacco taxes. We had a $5.4 million ad campaign each year. Part of it went to addressing tobacco, and its harms, the other part to help people quit smoking. So these are all the things that we've done, and that's why we're actually going out about a year earlier than the 25 years, is because we're running out of money. But we tried to do that purposely to just really make sure that it was focused on these programs that help Minnesotans.
Thank you.
Thanks, Shep. Good to
Yeah.
be have you with us.
Yeah, take care. This is fantastic. Thank you so much. A lot of information. I feel like all my life there has been some education about anti-smoking and the fact that it's still this big of an issue. But to hear the new research, right, as vapes are developing and the world doesn't stay stagnant, it consistently changes. This is really interesting, helpful, and I think timely as we are focused on our health so closely during a pandemic. Additional ways to be safe are, of course, encouraged maybe more than ever right now. Are there any other questions? We're like right on time on the button here.
I've just got to say a shout out to Jeanne. I'm from Mobridge, and I think we've met once before at the Arboretum.
It's wonderful. Those of you who don't know, I have an arboretum in Mobridge, South Dakota. Brian, fantastic. What a small world.
It's a super small world. Okay, and as we are wrapping things up here, I'm going to pull up the 4-way test. We recite at the end of each meeting of the things that we think, say, and do. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned? And with that, today's Golden Valley virtual session is adjourned. Thank you. Thank you, Jeanne and David, for your time. Lovely to see everybody.
Thank you all.
Stay healthy.
Bye.